how long does it take to do the procedure? A routine RLE surgery, and typically RLE surgeries are all routine. They take about 5 to 7 minutes to do. So very quick, certainly quicker than a dental cleaning, much more comfortable. It's inevitable that every patient's going to feel some level of anxiety. Usually most people are pretty anxious before surgery, but after the first eye, everyone's like, oh, that was easy. That's it. Yeah. Now, more complex procedures will take longer amounts of time. So if you had America's densest cataract, well, that might take 10, maybe even 15 minutes to do. If we're doing a intraocular lens exchange, like you're upgrading your lens to a multifocal lens or like the best and greatest lens right now, that might take anywhere between 6 minutes or up to 30 minutes to do, depending on again, often when you've had previous surgeries, it kind of depends on where and how the previous surgeon did your surgery. So you just have to go a little slower, because most of the time you weren't there for the surgery, and you don't want to, once the surgery has been done, there's, things change, and maybe you're not used to the incisions that the previous surgeon made, or you're not used to the way the lens was put in, or how big the opening is. You just kind of take your time. You don't take anything for granted. So if you were the surgeon doing a revision on your own surgery, or it's down the line, this patient wanted a different lens or something, it's very easy. It takes about 6 minutes to do, because you know where you put the incisions, how you normally do things. But when it's another surgeon's surgery, we tend to, it's really smart to just slow down. All right, thank you. Oh,